Hello, in this case study, the therapist examines the following hypothesis. To prove that an elevated ilium and anteriorly rotated pelvic tilt can be corrected using muscle energy techniques in a more timely, effective, and efficient way in one treatment than the passive massage therapy techniques. The hypothesis was chosen to compare the difference between the two schools of thought, the Swedish massage therapy techniques and the newly introduced muscle energy techniques when dealing with the same recurring issue, for example, pelvic imbalance. The other additional reason this hypothesis is being used and tested is to be able to incorporate the techniques that work best in a shorter period of time into the therapist's future practice. The client's health history indicates that he has been having chronic low back pain that would disable him from work for days at a time. In the previous treatments, the therapist was using Swedish massage techniques to decrease the subject's pain, thus proving that massage therapy does work for the client. However, the symptoms with the low back pain continued troubling the client, and he would be back once every 6 month period. This indicates that there is a limitation in current practice as a massage therapist. After two osteopathy courses, advanced assessment techniques help the therapist to be able to see very clearly that the following issues were wrong with our client's low back. The left leg was longer than the right one by 1.5 centimeters. The left ilium was higher from a posterior view by about 2 fingers width, and both of the ASISs were rotated forwardly. They were lower than the PSIS as well by 2 finger width bilaterally. And since one hip was hiked in a standing position, the lower back, L1 to L4, were rotated to the right. The recognition of the interdependence of structures principle and the articular integrity principles have helped to improve practice and notice things that have been ignored before. These and other careful examinations have surely been disclosed after our clients consented to all of the work that needed to be done on him and in all of the private and confidential information that would help the therapist to adequately aid the client with the healing process. The beneficence and non-maleficence principles has been satisfied as client has both his and his wife's coverage for the massage, and there is no potential harm to client's health as he has explained the treatment plan and knows what to expect in the 2 treatment sessions. Biological determinants. There are many lesions associated with our client that play a contributing role to the current healing process. Some of which include visceral lesions. For example, he has a chronic bronchitis, psychological lesions, stress from 70 plus hours of mentally responsible and physically demanding jobs, hereditary or biological lesions, length, leg discrepancy by 1.5 centimeters. All of this and other serious physical traumas that happen in youth years are hindering the recovery process as there is less time to be spent rehabbing or spending quality time with the family. Things that may improve our client's healing is more time spent relaxing, consistently attending the health centers who can focus on physio, rehab, massage, osteopathy, manual therapy, chiropractic, podiatrist, and perhaps even psychological or spiritual rehabilitation. Our comparative study was based on one massage treatment with the standard Swedish massage techniques, that is, effleurage, petrissage, ischemic compressions, done on low back and hip joints to correct the elevated ilium and rotated innominate bilaterally, and one osteopathy manual session with the focus on just 2 muscle energy techniques which are banana boat technique and anterior innominate correction technique, to do exactly the same goal. Time frame 10 minutes or until improvement in hip alignment is noticed. Assessment and reassessments are used as tools to measure the result of the study. The result shows that massage therapy techniques hip advancement only showed after 45 minutes of treatment. Osteopathy session with muscle energy techniques showed improvement after 7 to 9 minutes. Client has provided with the informed consent at the beginning of the video to be partaken in the case study for educational purpose only. Now, regarding his personal treatment plan, client has approved the treatment plan, which is very impressive, as he usually does not have any extra time for consistent visitation to the clinic. This time he did ask specifically that he is willing to take time off work to just focus on the health improvement, otherwise he would get nowhere. We have determined to spend 4 sessions, of which the first one is meant to proper assessment of all the utilities, the GOT test, the muscle strength flexibility test. Second one will address the utility 1 correction and unity 3. Specifically, we'll focus on a counter nutation adjustment, elevated ilium adjustment, anterior rotation adjustment, and lumbar spine correction. The third treatment will reassess again the unities and posture with screening tests, and we'll be working on unity 2 upper back via massage, some massage, and myofascial release techniques. The fourth session is an overall assessment and a correction where needed. All in all, we have come up with a plan to work toward the client's proper alignment and even discuss the possibility of attending other referred places to better integrate our holistic approach. This decision was based on a partnership principle of osteopathy manual practice. The appointments would be held once a week for 4 weeks, 1 hour per session, with the first 15 minutes taken for assessment purpose. And the client will be paying only the 45-minute massage treatment. The cost-benefit analysis shows that this is a win-win case, and he was already determined to do something about his health. In addition to that, his work was flexible to show and to allow him to spend more time off towards restoring his health back to normal. It also benefited the therapist, as he would be paid for each session and at the same time be allowed to practice osteopathy manual therapy techniques. The result of the case study, as seen on the videos, clearly showing that there is a considerable improvement in the client's pelvic tilt and hiked up ilium. The video of the massage techniques used is not on the video as there is time restriction. However, when compared to the first treatment, there was a great difference in the result. For standard Swedish massage, the techniques used were ischemic compression, patrissage, affleurage for the hip and low back. And it took 45 minutes just to get some spasm to loosen up. However, with muscle energy techniques, aka the banana boat technique and anterior innominate correction technique, the result was obvious after 7 to 8 minutes of work. The therapist wanted to keep it as a surprise and did not tell the client what he is trying to do, and he did not rehearse this with the client to see if the techniques would work prior to the session. In the end, it was surprising for both of us to see the immediate improvement. The therapist does acknowledge that there are limitations to the muscle energy techniques. However, this experiment did let us single out the muscle energy techniques, as we were doing the comparison of only one to one session, one massage therapy session to one manual osteopathy session. Limitations in our client's full gain of pelvic symmetry was influenced by many factors, like lack of precise sacrum manipulation, coccyx correction, lumbar spine correction, leg muscle hypertrophy, client's proprioceptively disordered muscle memory, lack of myofascial release in the hip joint, etc. Short-term goal for our client is to maintain the balance of the pelvis and low back. And the long-term goal is to address the overall well-being, addressing his other lesions listed above by possibly referring him to other specialists and seek more balanced quality of life. Client could improve a lot by attending my monthly or bi-monthly massage therapy and or manual osteopathy sessions, by attending podiatrist and getting prescription for the insoles. Also by addressing his lung issues with the medical doctor. And last but not least, seeking correct exercises from a physiotherapist to establish and improve muscle balance. There are some limitations in the research as the study was narrowly focusing primarily on the efficiency and timeliness of the osteopathy techniques versus to those of the massage ones. We weren't addressing the holistic approach to the health of the body. However, if we would take a look at the tensegrity principle, the changes that are being produced, though very locally, will affect the rest of the body. Having said that, there are many health benefits of Swedish massage techniques that are helping with our clients' general health and fluidity movement, which cannot be objectively compared to the pros of osteopathy techniques. Both have value and the right place within the holistic approach in a human body. For the further studies, the therapist would most likely choose a great number of participants, at least 10, with similar lesions, and examine each one over a period of maybe 1 year to be able to see if the improvement of the corrections are not only timely and efficient, but also whether the effect of the correction is short or long-term lasting. The role of osteopathy is crucial in the recovery process of the client. However, it is within the scope of practice of a manual practitioner to seek an integral approach towards healing, and therefore the role of other healthcare practitioners is very important. With the low back and hip issues of our client, it is necessary therefore to collaborate with other practitioners such as massage therapists, medical doctor, chiropractor, physiotherapist, pulmonologist. Conclusion. In this case study, the therapist has gained significant clinical knowledge of assessment, palpation, observation, and treatment skills. We've put to the test the osteopathy techniques that are used to treat pelvis misalignment for low back problems. The lesson is clear regarding the efficiency and timeliness of muscle energy techniques, which are beyond doubt effective and will be utilized in our future clinical practice. The most impressive part is that the result of the muscle energy technique manipulations happen prior to the warm-up of the body. This shows that the efficiency is getting the desired job done within a short constraint of time. The experience that has been gained here translates into the tool set of knowledge, allowing the therapist to use it and to have more free time on his hand to perform other manipulations in other parts of the body.